Peptides are powerful and often misunderstood.
But we are here to change that.
I'm Dr. Kylie Burton.
And I'm Jessica Briecke.
This is Pep Talk, Peptides Unpacked. Science made simple, results made real. Today's episode is for anyone in the wellness space: trainers, nutrition coaches, chiropractors, health coaches, functional medicine providers, and anybody else who's looking at incorporating advanced peptide therapy into their lives to help them feel better and live better.
Because today we are joined by somebody who embodies that mission on every single level. The incredible Dr. Jared Ward, one of the leading chiropractors in Southwest Florida.
Dr. Ward graduated with honors from Life Chiropractic College West, and what really sets him apart is his approach. He doesn't just chase symptoms, he looks at the whole picture, the root causes, and how the body's systems work together.
And that's why he's the perfect guest today. His approach to healing, from nervous system alignment to functional medicine, it flows perfectly into what we're seeing with peptides and integrative wellness.
Dr. Ward delivers deeply personalized care, and now he's bringing peptides and affiliate partnerships into his practice to support clients on an even broader level, metabolically, structurally, and functionally.
So today we are talking about his journey as a practitioner, why he believes metabolic and regenerative support is the future of wellness, and how he's building a business that expands both his impact and his income.
So, whether you're a coach, a trainer, or a practitioner, or simply someone passionate about helping others and looking at more peptide therapy,
This
adding it to
conversation,
your space. Sorry.
that's okay. This conversation is for you. So let's dive right in with Dr. Jared Ward. Welcome.
Thank you guys.
If I
Appreciate
slip and
it.
call him Jared, I'm really sorry because Dr. Ward is not what I'm used to calling him.
Call me Jared. Call me Jared.
Jared, what do your patients call you?
They call me Dr. Jared.
Okay,
Yep.
Dr. Jared it is.
Perfect.
All right. So Jared is see, I did it. Dr. Jared is well versed in peptides, and we're going to talk today about his top five favorite peptides, a little bit of science behind each one, and how he's seen them in the clinic. So, what's your top peptide?
Yeah, well, I got into peptides because, my dad to give just a little background before I dive into my top five, if that's okay. My
Of
dad
course.
is a renowned surgeon who specializes. He's a podiatrist, but he mainly does surgery. He's a residency director. He was second in the world to do a certain type of surgery. He has a fellowship in orthoplastic nerve and reconstruction, right? So I grew up seeing like the importance of acute care medicine, but I am a very holistic minded chiropractor, right? So the way I view peptides is kind of like they're not like 100% natural. They're not growing out of the earth, right? But they are but they're not, as I would say, synthetic as a pharmaceutical. And so I think they're this like beautiful gray area that can help my patients really overcome a lot of things that they might be struggling with otherwise. So I've just seen them help so much. They've moved the needle when like everything else has not. So I really love them. One of my favorites, these are in no particular order, but one of my first favorites is actually Tesamorelin.
Oh,
So
yeah.
that one is one of my favorites because it's this beautiful peptide that basically helps the body. First of all, it's FDA approved for HIV or AIDS patients to prevent muscle wasting. Okay, it's been FDA approved for a long time for this population, and so therefore, has a lot of safety research behind it and also efficacy behind it. And what this peptide does is it helps not only retain muscle, but it helps grow muscle while at the same time burning off visceral fat. So, visceral fat is the type of fat that accumulates around the organs, right? It's the more dangerous type of fat. And so, it helps burn away the fat plus grow muscle. And I don't care who you are, you should want that. Okay. Because the more muscle you have, the longer you live, the more resilience your body has. The muscle is not just for strength, but it's for immune modulation, hormone modulation, fat burning, right? So that's why I love this one. It's excellent. So it helps. And the thing that's really cool about peptides is like Tesamorelin doesn't just put growth hormone into your blood to make you grow muscles. It stimulates and sends a signal to your body to make its own growth hormone. So it's much safer than like, well, injecting growth hormone, right, as some gym rats may like to do, or things like that. So I love this one for those reasons. That's my favorite one. So I'll use it for like, anyone who wants to lose a bit of that extra belly fat, improve their metabolic state of health, even for sleep enhancement, because when you have more growth hormone released at night, you get much, much better sleep. So I would say this one is one of my favorites, just because I feel like it hits so many different things that a lot of the modern patient is dealing with, without having to do, multiple peptides. So that's probably one of my first favorites.
I have a million questions.
Okay. I'll do
So
my
I'm going to lay them out and then I'm going to let you take it because you speak so well to this. So first of all, when we talk about visceral fat, obviously we are talking about increased incident of things like cardiovascular issues. So people that are predisposed genetically, or that's where they're carrying the weight. I mean, how many people do we know that have these stick legs? From the backside, they look great, and then they turn around and you just see all this belly, just all in the belly, chest, barrel-chested men. That's
Yep.
visceral fat. So there's that cardiovascular aspect I would think is important here.
Yes, 100%. Yeah, when I talk about fixing the metabolic system, right? When your metabolism or your metabolic system isn't working well, that's when you're developing those very American Western diseases like cardiovascular problems, fatty liver disease, diabetes, right? So getting rid of visceral fat helps with all of those conditions.
What about what is the course typically for somebody that is using this? Is it a short term, like when we talk about, which we may talk about, I'm not sure what your top five are, but if we were talking about like BPC 157, that's a short term course. Is
Right.
this the same thing?
This one is about an 8-week course.
Okay.
That's
And
how I,
can it be stacked?
yes, of course.
Safe to stack for anybody that doesn't understand what I'm asking is it's safe to stack with other peptides, whether that be your GLP-1, whether that be your, like I said, the BPC 157, whatever it is safe to stack
Yep.
this together.
Yep, this one's safe to stack, and I'll usually have my patients do 2 months on, 1 month off. If they're handling it well, they recommend you can do it up to 3 months on at a time, but I usually just go for the 2 months just for extra safety. But this one you do inject. I have them do 5 nights a week, 2 nights off, just because you don't want to. Again, you want to blunt you don't want the body getting used to the stimuli, right? So that's why you take 2 nights off. But
Right.
I love
Got it.
pairing this one. I love pairing this one with Retatrutide, actually.
That's exciting too. Is that going to be your number two?
Yes, it is.
Let's talk about it then.
Okay. I mean, so I started my patients on Terzepatide at
Mhm.
first for a while, which they got good results. However, I like Reta even more, or Retatrutide even more, because so semaglutide acts upon one receptor. These are the GLP-1s that everyone knows, right?
Right. Okay.
Semaglutide or Ozempic acts upon one receptor. Terzepatide acts upon two, retatrutide acts upon three. The third one, I think, is the powerhouse because not only is it, the first one, it helps with appetite, right, and cravings, which is the one that they all have in common. The second has more to do with insulin sensitivity, metabolic stability, which tirzepatide has, which is great. But the third one is the glucagon receptor agonist, which basically means that your energy burning gets elevated. And when you're burning more energy, you will therefore burn more fat. So not only is it helping you resist those cravings, resist those urges, helping balance your blood sugar, but it's also helping you burn fat at a faster rate than someone who is not taking retatrutide. So that extra component helps, in my opinion, it helps you not have to starve yourself as much because you have the wheels turning, the thermal energy going a little bit more. Because what I do worry about my patients who are doing higher and higher doses of semaglutide and even tirzepatide is, again, that muscle wasting. And that's why I like to pair the retatrutide with the tesamorelin, because you have the muscle protective effects of the tesamorelin paired with the fat burning and metabolic enhancement effects of the retatrutide. So you're really, if you're doing your protein and lifting your weights, right, and then also doing tesamorelin, you have like the secret sauce to muscle preservation while you lose the visceral and other fat. So
That's a beautiful combination. And the company that we're working with currently isn't offering this particular peptide, and I'm really hoping, and I have a feeling that it will be coming down the
I
pipeline. I
hope
can't
so.
wait to offer it.
Yeah.
Um, I would say that you hit on something that's really important. We talk about it, I talk about it all the time, which is your foundations still have to be in check.
Right.
So, with any type of GLP agonist that we're talking about, whether it's sema, whether it's TERS, whether it's the retro right here, whatever it is that we're talking about, you can't ignore the fact that we still have to be doing all the lifestyle things, or we're going to just end up, in my opinion, back in the situation that got us here to begin with.
Yeah, I mean, I actually think you'll be even worse because again, with
Agreed.
with the GLP-1s, the risk is muscle loss. And if you lose a lot of weight, but you're also losing muscle, that means you have less fat burning material at the end of your treatment or your protocol, your peptide protocol than before. So I don't let my patients in my practice do peptides at all until they prove to me that they can regularly take their supplements, they can change their diet, and they can work out and lift weights at least 3 times a week. If they're not doing that, I will won't sell it to them because I don't want to make them worse off than what they were before, right? So
Yeah,
Jared, say that one more time.
yeah,
You don't offer peptide therapy until they've done the foundations, which includes
right.
regularly taking their supplements.
Mhm. Regularly taking their supplements, making dietary changes, and working out, lifting weights at least 3 times a week.
I'm going to add one more thing that I do.
Yeah, go ahead.
I'm making sure that they're pooping
Of course, right, right.
because this slows gastric emptying.
Yep.
And everybody has this like, well, I poop every 3 days. That's normal for me. It's not normal. We need to fix that first because if you
Right.
go on this, it's going to amplify that problem that you already have. So before we go there, we have to address these things too. So there is definitely some steps that people need to take. I will say the other side of that though is sometimes people do struggle with being able to make some of those changes because they're so deficient in these peptides that they struggle with the ability to, they know they need to make some changes. They're struggling to make. So what do you do in that case? Like if you think that somebody might do well with this peptide for that particular reason, they want it. They really want to make the changes and they're struggling.
Hmm. You mean because they're struggling because they're fighting cravings, or what do you
Yeah,
mean?
because they're fighting cravings, they're that constant that cycle. Now you and I know, and Kylie too, that when we can get people to like quiet down what they're doing with processed foods and sugars and moving their body, that is going to naturally kind of quiet down anyway. But sometimes I think we have some tough patients that are hard to get there. So is there ever an exception? I guess is my question.
Mm, for me, not really,
I
honestly.
get that.
Yeah, I will typically lean into, going off the trail a little bit. I'll typically lean into some herbs or some microbiome work to help reduce those cravings. And oftentimes that works really, really well.
Yeah.
Um, particularly like gymnema or things like that that's an herb that helps literally change your taste buds and your cravings and modulate and repair insulin receptors on the cells. So that's an example of how you reduce cravings. I have so many patients who are like, oh my gosh, you put me on this like microbiome support and now I don't even crave sugar. So I typically tend to deal with cravings that way first. I have and then we can consider peptides.
Love that approach. All right. So that's number one. Number two, number
Mhm.
three.
We did number one, we did number two, now we're on number three. Oh, I love this one too. So I am an immune system guy. Like I helped teach immunology at my school when I was in chiropractic school. I had like 50 students show up to my, teaching assistant classes. So I love the immune system. I have a lot of autoimmunity in my practice, Hashimoto's, lupus, whatever, psoriasis, whatever, you name it, I got it. And so this peptide helps basically clear out really any deep infection, helps modulate the immune system. They're studying it with cancer patients. I don't treat cancer in my practice, but I will support a body that has cancer, right? So this one's thymosin alpha 1. I don't know if you could tell that's where I was going, but I would call it like the immune intelligence peptide. I would say just like our bodies and our immune system are under such a barrage of information from every direction, whether that's other injections that are rewiring the immune system, whether that's environmental toxins, whatever. And this one just helps modulate everything, kind of, combing through the tangles of the immune system over time. And so it helps modulate the white blood cell reactions, helps reduce inflammation, and just balances the immune system. So I love it for my autoimmune cases, anything
I was just
chronic.
going to say, you give it to your AI people.
Oh yeah. I mean, I have one patient in particular. Um, she's just finishing up month 2, and she's been in this practice for probably before I was here. She's been in this practice probably like 20 years, and she was getting to the point where she was pretty much immobile, in terms of just like stiff, couldn't, hang out with her grandkids, et cetera, et cetera. And the first month of the low thymosin alpha 1 dose, she felt about a 20% improvement. And then I just saw her, was it yesterday or the day before? She was super happy. She's in month 2. She's down on the floor with her grandkids. Her psoriasis, admittedly, is still there, but her joint pain so much better. So that was just really cool because she's just like a walking ball of autoimmunity, poor thing. But this has been really a real game changer for her. So I love this peptide.
So you mentioned it as something that can help support your people that are in cancer treatment. What about does this help people that have chronic nerve pain? Or is that something better for something like that?
It
Because I'm
could
just thinking about some of the things that you just mentioned. I'm wondering if that would help that at all.
It could, especially if like, well, because it helps with inflammation, right?
Right.
So indirectly. So that's where I would use it. You could use it for. I would also try for nerve pain, maybe like TB 500,
Yeah.
T157. I depends, I guess. I would want to know, where's the nerve pain coming from? Is it a peripheral neuropathy thing because of blood sugar and diabetes? Then we might go more of a GLP-1 route, right?
Yeah, yeah.
Um, you could stack it with this though, for sure. So
That's a really interesting one. Just say the name slower.
sorry,
No,
thymos.
that's okay, so that everybody that's listening knows exactly what you're saying.
Yeah, thymosin alpha 1, THYMOSIN, and then alpha 1.
Awesome. Okay. I love that. I am unfamiliar with that one, so I can't wait to dive deeper on that. That's a new
Yeah,
one to me.
it's so cool. I love that one.
I think we're going to
That's a
hear you
game
say that
changer
about
for the
all of them.
autoimmune
Oh,
Yeah.
what? Sorry.
It's a game changer for the autoimmune
Yeah,
population.
yeah, yeah, totally.
Cool. All right, Jared, number 4.
Okay, probably I'm gonna have to go with GHKCU for this one.
Okay.
Ooh,
Um,
spicy. This is a spicy one.
is it spicy? You're gonna have to tell me why it's spicy. I
Well,
love this.
spicy the injection. People say
Oh,
this is a spicy injection.
oh yeah, the way it
But
feels.
the
You
but
mean?
the reaction we can say it's spicy too.
Yeah. So I had a case of female pattern baldness, and the way I have my patients do this one is, well, before I go into that, I guess, but basically this is called the beauty and repair peptide. So again, it's naturally anti-inflammatory as well, but it helps with collagen formation. So like skin health, hair growth, things like that, tissue regeneration, but even like wound healing, right? Anything where you need more collagen, this is a great choice. So I had a patient, female pattern baldness, and she had tried everything, right? And it was, we're dealing with like PCOS, insulin resistance, a little bit of metabolic syndrome. And anyways, we got her naturally to lose about 50 pounds, which was awesome. Over the course of, quite some time. She didn't really want to do any GLP-1s. And but we wanted to try to see if we could fix the female pattern baldness. And so the way I have my patients do this is, they get the injection, they do it subcutaneously. It is spicy. It did leave a little bit of temporary nodule
Warming. We'll call it
welt.
warming. Yeah.
Yeah. So that's not fun. So warn, if you're gonna do peptides, warn your patients about that. And then I also, what I have people do is like, those like micro, is it like micro abrasion, like
The
little
the
blurs?
blades. You
Uh,
mean?
not blades. It's like a roller with like little spikes on it.
Oh, yeah, yeah. Okay, yes.
I'm sorry, the proper name is escaping me, but I'll have my patients like do that over their scalp, of course, gently, like not too bad, and then do put a little bit of the GHKCU from the same vial of the injection and mix it in with like a serum and put it on their scalp. So they're getting it subcutaneously, but also directly on the scalp tissue as well to help regenerate the hair follicles. So
That's
um,
brilliant. Now, is that only in people that are losing hair for some sort of metabolic reason? What about like people like men, with their,
Yeah, any hair loss. Sorry, I was just kind of explaining more of else what was going on with her, but
sorry.
independent of a metabolic problem, any type of hair loss, or even someone who just wants thicker hair, right? It doesn't even have to be, fully bald, obviously. But um that's what I use it for. Yeah. And it was great. She started within about a month, she had little baby hairs coming back, and it was very, very awesome. She was very encouraged.
That's incredible. I've never heard it applied that way.
Yep, that was so one of my friends, he provides a lot of the clinics with the wholesale peptides. We have a compounding pharmacy in the UK that we use to supply these clinics, and he is a wizard when it comes to like all the cellular mechanisms and everything. And so that was actually a tip that he gave me, and it works quite well. Mhm.
People that are looking for the fountain of youth are loving this particular peptide.
Right.
And one of the things that comes to mind too when I'm thinking about this is we have people that have done standard dosing,
Mhm.
fast dosing, and I'm a big fan of microdosing in peptides
Yeah, me too.
for right. So we in previous episodes we've had lots of conversations with people about rapid weight loss. And those that have struggled, including myself at different periods of my life, we want to click our heels, lose the weight yesterday, and move on. So it's appealing, it can be addictive, and all of that. And so, unfortunately, we do have a lot of people that are prescribing that don't understand the mechanisms, that are not supporting their patients, that are doing standard dosing titration based on the FDA approved drugs, and they're
Yep,
losing weight quickly. They're losing the fat pockets in their face, and they're coming up with the Ozempic face, right?
yep,
So we know why that's happening.
yes.
Um, would this support any of that?
I would imagine so. I haven't paired this as much with GLP-1s yet, but yes, it would because it would support collagen formation. It would be a bit of resistance. I don't, if you're going to
I'm
continue.
thinking after, not even,
Oh, yeah,
because some people are like, they're in it, they don't care. And then afterwards, they're like, oh gosh, what did I do? What did I
right,
do to myself? Do I have to go see the plastic surgeon now? You
right. No,
know?
I would definitely recommend this, 100%. Yes.
Okay. I love that too for them. There's other options for people that have maybe gone hard and gone fast. Can you hear that
Is
buzzing in the
there a way
background?
to?
I'm sorry about that.
We can't hear it. I've
Okay.
got F-35s over my head too. It just, I can barely hear you guys and they're over because they're so loud. Is
Wow.
there another way to get GHKCU besides injectables?
Yes, so I went to a peptide conference last year, September. I think SSRP is a great like certification course for any practitioner or coach or whatever who wants to just get a basic education of peptides. And there was a lady I met there, her hair grew back thick actually just from taking an oral GHKCU, which I thought was crazy because usually oral doesn't work quite as well. But she was a walking testimony to that for her. So, and then of course there's GHKCU and a lot of serums and everything too that people put on topically. The reason why I have my patients do it directly from the vial that they're injecting.
Micro needling. Is that what it
Micro,
was called? It just
yeah,
came to
yes.
micro needling.
I'm gonna look it up.
It's a microneedle roller, I believe.
A roller, yeah, it's a
Yep.
micro roller. Yep. Thank you. That's exactly what I was thinking of. What was I saying? Oh, I just don't know the shelf life of some of the GHKCU products in terms of salves and serums. So that's why I kind of would have my patients do it on their own. Um, but that depends on the company, right? So,
Okay. I
So
want to
with
circle back to that concept with getting peptides and other modalities because we all know there are a lot of different supplement companies who are
right.
starting to incorporate them or have created their own company around these. But let's go on to number 5 and then we can talk about
Yeah,
what
okay.
type is best recommended, I should say.
Right.
Okay, number 5.
I kind of cheated with number five. I'm, at first I grouped two together, and now I might add a third, just as a little, rabbit trail.
Okay,
Um,
top 7. We'll forgive you.
but basically, this one, the blend, the classic blend. I mean, sure, pretty much everyone's heard of this one. BPC 157 and TB 500. This is just amazing. I mean, I'm a chiropractor. There was one time when I injured my wrist for whatever reason, and I still had like 35 to 45 people a day adjusting, and I was doing everything I could to help my wrist. I have PEMF machines, which are like an electrical therapy device to help with inflammation in the office. For those of you who don't know what that is. And I was doing that for like 3 hours a day, an hour before work, an hour during lunch, an hour after work. I was getting it adjusted. I was doing all the muscle work, the soft tissue work, everything. And it was like 2, 3 weeks, and I just was plateauing. And I was like, oh my gosh, like this is my livelihood. I have to figure something
Mhm.
out. Well, I had a bottle of BPC 157 and TB 500 back in my refrigerator in the office. And I'm like, well, I don't know why I didn't try this sooner, but here we go. And so, I did my self inject. I don't necessarily advise this to those listening, but I did self injections in my wrist joint, just under the skin with a little insulin needle, right to risk avoid injury. And I kid you not, after one injection, my pain was reduced 50%. One injection. And this was after I've been trying for weeks, right? And I'm throwing everything I have at it, shockwave, everything, right? And I was like, holy cow, this works. And
That's
so
good.
the BPC 157 TB 500, you can inject twice a day. So I did it twice a day for a little bit. Then I went down to once a day, and my wrist was good as new within a week. It was amazing. And so just for my patients with I do with just the acute injury, it's excellent. However, the other, part of this I really love is just the gut healing proponents of BPC 157 and TB 500. I got into this field because of gastrointestinal stuff, and I still love helping people heal their guts, and that's just what I'm really good at. And so the BPC 157 is an excellent that's originally like, what it was used for, right? But it's an excellent oral, if you take it orally, to heal the gut lining. And then just like my little segue to my third one is Retatrutide. I don't know if you have heard of that one. That one is an amazing gut healing peptide. It literally takes a leaky gut and it just goes, sucks it all right back together. If you know the zonulin marker, that's a marker that is made with a leaky gut. I know you guys do, but the
We
listeners,
know, yes.
but the zonulin is basically a measurement of how bad is your leaky gut. And leaky gut is I would say, the start of all autoimmune disease, a lot of chronic inflammation, right? If your gut is leaky, you're leaking into yourself, and that's not good, right? So,
If you got leaky brain as well.
right, exactly. So, anyway, so any of my patients with skin conditions, because skin mirrors the gut lining, right? Inflammatory brain diagnoses or symptoms, or gut inflammation, joint pain, really, I love to put them on something that helps heal the gut lining. And lorazepam is amazing. It's awesome. It's a bit harder to find, but that one taken orally is beautiful as well. I've even seen cases of pediatric cases with terrible eczema. Within like a week or two on lorazepam, it's gone. It's beautiful. So
I got to tell you that I'm tearing up listening to you because in my entire career, and like I said, I have been in my career as long as you guys have been walking this planet. I don't think that I have ever been more excited than I am than working with peptides for all of the reasons that you have been listing. Like just listening to you, because we have how many people do we see on a regular basis that have lifelong struggles with poor gut health or skin conditions or chronic joint pain or whatever. The list is endless. And the three of us, have worked with root cause approach for so long. So to have this be able to help so many people with so
yeah,
many things, not just weight loss, which is huge in and of itself. This is exciting to me when I hear that. And I just started my own BPC journey recently for a 6 week random ankle injury that doing all the things, nothing was helping. And I've had the same response. It
yeah,
just is remarkable. And in my time in practice, 30 years ago, people didn't have shoulder injuries.
right.
People didn't have knee injuries. That's a whole nother conversation as to why I think that's happening now. but we're seeing surgery after cortisone injection and all the things that are so difficult. And to have these other peptides now that can help people heal their gut, heal their acute injuries, heal their chronic injuries. I'm emotional over it because it's just incredibly exciting. And hearing you talk just re-emphasizes why I am in business doing this.
Yeah, it's awesome. It's very, very exciting.
So, Jared, as we finish up here, you've mentioned how you have this in your brick and mortar practice
Mhm.
down in Southwest Florida. So if you guys are in that area, be sure to go check him out. He does have a very packed schedule. So call ASAP because you're going to be on a wait list. Get into
Yep.
Jared's life fast if you're thinking about it. But you also have an online presence.
Mhm.
And so you've started to incorporate another telemedicine company who can provide these peptides for a variety of reasons. But just
Yep.
give us, if anybody's listening to this, and whether you're a mom wanting to create some new financial streams in your world, whether you're a chiropractor like Jared and I are, I'm moving completely away from the client side, going all in on this, where Jared's going to do both of them, I would imagine. But what was your goal with getting started with our peptide company on and a couple different reasons why you said yes.
Yeah, well, I mean, I'm a clinician, but I also have a business brain. And so
A
when
very good one at that, you guys.
thank you so much. But basically when, you know, business is just getting people a beautiful and effective product in a great way, right? That's all it is. And so I think I don't have the bandwidth necessarily to help as many people as I would love to help. And so I have a new associate starting with me in like 2 weeks. So my wait list hopefully will get shorter. But then also just like I have about 11,000 followers on Instagram, which is very small compared to a lot of my friends, but I get constant questions. And so I just need to figure out a way, how can I streamline my offerings and my time so that I can help more people, because I'm on a mission to change the course of the health of this nation, because if we don't do something, it's not doing well, right? And so I cannot stay small and continue to just see people one on one. I will do
Oh,
that, but I
I
need to
love that. I
but
cannot stay small.
right.
Ah,
Yeah,
chills.
like I will continue to do that, right? Because it's the time I have, but I'm also building out ways to help more people in group programs. Like I have a liver cleanse, I have a parasite cleanse that I offer multiple times a year that goes really well. And I'm like, wow, okay, I can help, and people are getting the same results with these things as they would working with me one on one. So who am I to gatekeep people's success with my own limited schedule, right? So I just anyway. So the peptide conversation, I again have limited time to work with everybody one on one with peptides. And then also, I'm a chiropractor, right? I don't necessarily want to expose myself to the prescribing liabilities, one, because I can't, and two, I don't want to. And so, this company that Dr. Kylie was really cool to bring to my attention provides a way for me to get people the help that they need while also not using up more of my one-on-one time that I have available. So
Your
that's
bandwidth. You're impacting more lives
yeah,
while still doing the things you love.
right.
And why can't we have a bigger bank account? Who said that's against the
Right.
law?
Right. Well, a bigger bank account means you help more people effectively. That's
Correct.
great. It's not wrong. If you have this, if you don't have a bigger bank account, you haven't figured out how to help more people more effectively. And that's okay. But there's lots of ways to figure it out and proceed. So, yeah, it all goes together, right? So it's not,
Does.
yeah,
Your bank account is a reflection of how many people you're helping.
right,
It's really what it comes down to. And
right,
and you get to help yourself too, because I think so many people have had this conversation with affiliate marketing and they just immediately get turned off. I was
right.
one of them. I
Hmm.
remember when Jessica brought the first opportunity to me, I'm like, oh, okay, I'll listen. But
It's
then I
awesome.
saw what she was doing. I'm like, what are you doing for yourself? And then what are you doing from the business side? And for me, I'm in such a big transition in my life where I need to create something that's less stressful and where I can
Hmm.
be around my kids more often, but still do what I love, and that's marketing and sales, and still utilize this degree that I went and paid for and spent years for. So really, it's just another opportunity. It's another avenue to impact lives, and it's another
Yeah.
avenue to change my own and to change my own financial future within my family. So if you guys are thinking about this, go to drkylieburton.com/peptides to get started. And Jared, that I think we could like just listen to you talk about peptides for a long time now. So
All
we're so
day.
grateful for the last 30 minutes. But where can people find you as we wrap up?
Yeah, my Instagram is a great place to connect with me. It's just at Dr. Jared Ward, DrJarodWard, or my website, which is drjaredward.com. Those are two spots where you can connect with me, and my office address and number is all there too if people need that if they're local. So,
If you were to say one last piece of advice for somebody who's wanting to incorporate peptides into their business,
mhm.
what would you say to them?
I would say they're gonna get it somewhere. They might as well get it from you, and you're gonna be the safer doctor for them than the med spa selling it down the street. That's what I would say.
Well said. Every time we bring on a guest like Dr. Ward, it reminds me just how much the wellness world is evolving. People want root cause healing, they want personalization, and they want practitioners who actually look at the whole story.
Yes, and Dr. Jared is a great example of what it looks like when you combine traditional skill, functional insight, and modern tools like peptides, all while creating a business model that actually supports freedom and impact.
Whether you're a trainer, a nutrition coach, a chiropractor, a health coach, or any kind of wellness pro, you can expand what you do and elevate the way you serve without burning out or trading your time for dollars forever.
If this conversation inspired you, make sure that you follow the show because more practitioner and wellness leader bonus episodes are coming. We are just getting started.
You can get started at drkylieburton.com/peptides, whether you want to start taking advanced peptide therapy yourself or incorporate this as an income stream in whatever you are doing in your life. Go to drkylieburton.com/peptides. You can find me also at Unshakable Brain, my other podcast.
And you can find me at b2bwithjess.com or on my Instagram. That's jessb_LMT_NC. And if somebody brought you to this podcast to listen along and learn more, make sure you go back and have a conversation with them. See how you can get started in business here with peptides.
Yes, this is Pep Talk, Peptides Unpacked. Science made simple, results made real.